So I want to thank you guys for joining us. Today, Doug and I are going to give you a little bit of an overview of Keystone's line of 3D printing resins, and to discuss some of the integration of those resins into workflows throughout both open source and several closed source systems, give you the lay of the land of the workflow, and we'll spend some time focusing sort of on our flagship product, which is KeySplint Soft, and we will save time at the end for questions. So with that, I'm going to jump in. I hope everybody can see my screen. I want to start off and just give a very quick background of Keystone for those of you who don't know us. We are a global dental manufacturer. We work in several verticals, from dental to also cosmetic nails to face cosmetics as well. We have 3 primary manufacturing sites in Pennsylvania and New Jersey. They are ISO 1345 medical device, and we're also a pharmaceutical drug manufacturer, and our headquarters in Gibbstown. We've got over 400,000 square feet of manufacturing in the United States. We keep material in stock. We're able to get material out the door quickly, and we have a global presence, including facilities for fulfillment and sales in Singen, Germany. Keystone started this project about 4.5 years ago, and here on this slide you can see the actual original brainstorming session from our internal meeting about how we came up with the concept for our 3D printing line. I always find this amusing because simply reading the list indicates how little we actually knew about the project in January 2016, and how much we've learned and how far we've progressed over the ensuing 4 years. So today I'm going to give you an overview of all of our resins, including our laboratory resins and our medical device resins, all of which are biocompatible. Our materials have 3 years of shelf life. That is a very big distinction versus our competitors. Most are only guaranteeing 1 or 2 years of shelf life. And our materials are generally designed for any open source DLP printers. So anything using a projector is the type of printer that KeyPrint resins will work quite well in once we walk through our validation steps to make sure that you're getting really good results in every printer and every cure box combination. We commercialized KeyPrint in January of 2018, so we've been selling the product for about 2 years. And this slide's really interesting. This is a study conducted by the Key Group in Maryland, and here you can see in just 2 years, Keystone has become really the #1 open source resin for 3D printing. In the bucket here that you see for 90%, that's for people who are buying directly from their printer companies, and Keystone is also in this bucket by working with our partners. So this is a really interesting slide to us, that in just 2 years we've really become a premium choice for open source resin manufacturers, and we are really one of the only companies doing it here in the United States. So with that, I'm going to turn to a discussion of KeySplint Soft. Hopefully some of you have seen or read a little bit about it. It's a really, really innovative, different product. It has solved a lot of the problems that 3D print and splints have had over the years. The efficiency of manufacturing night guards and splints through 3D printing is off the chart. So today we're going to walk through a few things about KeySplint Soft. First, I'm going to go through sort of some of the qualitative things about the product that makes it so different and interesting. We're going to go quickly through, and probably more to Doug's part of the presentation, is the workflow efficiencies of using KeySplint Soft in a variety of open source workflows, printers and cure boxes. And then I'm going to spend some time talking about the value to the lab. How much money can you expect KeySplint Soft to put into your product if you adopt it in your workflow? So there's a series of things that really make KeySplint very special. Patent pending technology is #1. Very unique chemistries were brought to bear. It took us years to develop and design this product. And really what it does is it is a very durable, very strong device to protect the teeth against bruxism and TMJ disorders. But it's also got some flex to it. So in your mouth, it softens and becomes more comfortable for the patient. It is precise, it is very strong, and it is smooth, and most importantly, it is not brittle. That is primarily the #1 problem that prior 3D printed splints have had in the marketplace, is over a period of just a couple months, the materials become brittle and start to suffer from fractures. That is not an issue with KeySplint Soft. We've got devices in the field for almost 11 months at this point in Europe and Canada when it was commercialized. The US was commercialized through FDA clearance in November of 2019. And we've got thousands of devices that are now out there in the field with virtually no reports of failure. So the marketplace is very happy that we have solved a lot of the problems that 3D printed splints have had over time. The formulation is abrasion resistant, easy to polish, easy to clean, long-term color stability, and we are very rigorous about testing our materials for biocompatibility. This product's gone through a ton of testing, and it is very safe and very effective. It is cleared for sale in the United States by 510K. It is one of only 2 night guard or splint resins that you can buy in the United States legally. There are folks selling splint resin without having gone to the FDA and getting clearance. I would suggest to you that they have not dotted their I's and crossed their T's the way they need to, and that labs and doctors should be asking whether manufacturers have taken the steps to ensure that the product is cleared and safe and effective for use for its indicated uses, so that you can manage risk for your lab and for your doctors. We are also CE marked in Europe. It is Class 2 in Health Canada, and it is also available in Australia. It's been registered with the TGA. So night guards, splints, and mouth guards, and in Canada and Europe, there's also an added indication for snore and sleep, which is not present in the US at this time. We've got 2 formulations of the KeySplint Soft. One, we have a water clear version that we have optimized exclusively for our friends at Carbon. This project took several years of very detailed work to really dial in the material into that Carbon system. It is incredibly efficient. Doug's going to talk about some of our printer partners, and he'll touch base on some of the features of the Carbon system. But it is a production level printer. It is incredibly accurate. It is incredibly reliable. And we're very happy to have partnered exclusively for a clear version of KeySplint Soft with our friends at Carbon. This product is exclusively available through Zahn worldwide for the dental applications. Zahn's been a very valuable partner to Keystone. They can move material all over the world. They have 38 subsidiaries across the globe, and we thought this was an excellent partnership for this project to bring these 2 companies together with Keystone and for us to form a tight alliance on this. We also have a tinted version. It's got a slight violet tint, barely noticeable, and this is for all other open source printers, and Doug will walk you through some of our open source printer partners, but here you can see a couple of them are Sprint Ray and Asiga. We'll be talking about Envision Tech. We'll be talking about Decima. These are also printers. We have a full rigorous validation protocol that we go through to make sure our resins work in each open source printer and each cure box. We do a lot of work to make sure it's safe and effective for the users. All right, so one of the unique things, and we get this question a lot about KeySplint Soft, is how long can we expect it to hold up in the body? We've commissioned an independent study through Dr. Mark Latta at the University of Creighton. Dr. Latta undertook a study that you can get on our website. I'm going to walk through a couple key pieces of it here. When you think about the life cycle and the life expectancy for a night guard or splint, you're really balancing 2 features. Resistance to fracture and resistance to abrasion, like volume loss. Each factor is an impact. So if the material suffers internal cracks or fractures, you're going to suffer a break at some point in time. And over the life of bruxism, you will get material start to abrade down. So we did a study on how the material holds up to each of those forces. Dr. Latta is an experienced material scientist and a dentist. He's been involved in both industry and academia. He's got dozens of patents and articles in his name, and he did a really great job with us on this project. Dr. Latta, I usually hate to read PowerPoint slides to people, but Dr. Latta's words are pretty important here. So what Dr. Latta concluded was that the uniqueness of the properties of this material, particularly as it inside the body changes modulus, you get a dynamic property change, and it adds to this unique characteristic that should extend the life of the splint because it will prevent brittle fracture. KeySplint Soft has almost as much impact strength as our Diamond D high impact material for dentures. It is incredibly fracture resistant. We've had people climb on ladders and drop them from 20 feet and stomp on them, and it is very, very hard to break. And that is due to the chemistries that we put together. We've also studied the abrasion loss. So Dr. Latta put the product through essentially what is akin to 3 years of life wear inside the body, 4,000 cycles under this test. And we also compared it to some prior studies that only used half of those life cycles. And as you can see from this slide, both KeySplint Soft tinted and the clear version for carbon experience about the same volume loss as most of the other materials at half the life cycles. So KeySplint Soft has been demonstrated to be able to hold up against abrasion resistance at a very significant clip, at least as good as traditional materials, if not better. The materials that maybe hold up against abrasion and loss a little bit better are very, very rigid splints. And as Dr. Latta concluded, and as a lot of people know from their experiences, they're subject to brittle fracture. And so what KeySplint Soft's unique modulus change with temperature adds is a significant feature and benefit compared to traditional heat processed acrylic, as the latter material are known to become more brittle and prone to fracture over time. And as Dr. Latta in his study has concluded, that's exactly what KeySplint Soft has solved. The marketplace has recognized it as well. We'll get to a couple bits of feedback in a minute. Cleaning and maintenance is pretty easy. It's like traditional night guards and splints. Warm water and soap will do it. If you use something like Effordent, that is also adequate. We don't recommend people eating or drinking with the material, particularly hot liquids. We suggest people take it out, and we also suggest that people, if they're going to put it under warm water to particularly help with insertion in the patient, that it not be very warm water, it just be body temperature water. Anything above 47 C, you run risk of warping the product, which nobody wants. You need it to be accurate and stable. So now I've gone through some of the qualitative points with respect to KeySplint Soft. I want to turn to really a critical issue, and that is what's the value proposition? How can labs and doctors monetize these products into their practice and hopefully allow them to make money and then use that money in other ways to benefit their practices. KeySplint Soft is the highest form of evolution of night guard manufacturing. Traditionally, they were made by hand-poured salt and pepper or injected acrylic. It is a time-consuming process. It could take you hours to just make 1 or 2 splints. Thermoforming came along, was a much more efficient means of manufacturing a night guard or splint device. The throughput is not the same as you would get with 3D printing. There's still some manual steps and finishing in traditional thermoforming that is not nearly as efficient or with the level of productivity as 3D printing. There are folks milling splints. It's not a horrible solution if the product is stable as a PMMA splint. However, you can only really mill 1 or 2 splints out in a cycle run, so you've got a very high waste factor in the pucks, and you don't have a whole lot of throughput. 3D printing, and Doug will show you some of the throughput. Something like the carbon system, you could build between 10 and 14 splints on a build plate at a time. That's a lot of throughput. It allows you to produce at volume in a way that the other methods do not. This slide's really very interesting. So this is a set of assumptions built around the carbon model, but it would work for any printer that you use. You know your assumptions, folks. So if, for example, if your selling price from the lab to the doctor is $125, not $100, you can in your head or on a piece of paper do the math and adjust it to realize you're getting more profit. If your waste factor is 15% and not 12%, you're probably making a little bit less. So there are assumptions built into here. Build, design, and print time is about $245. Your assumed labor rate that you're paying your lab staff is $25 an hour. If you're paying 18 or 20, you know you have more profit. If you're paying 26, you know you have a little bit less. We're assuming 8 grams of material in the final device, a waste factor of about 12%, a selling price from the doctor to the lab of $100. And as you work your way through the math, you can see that per day, if you're making 10 splints a day, you're making about $800 in profit. If you are scaled significantly and you're just cranking your printer all day making night guards and splints, you can really scale up at that 40 splint per day number. When you annualize the amount, At 50 weeks, the lab profit at 10 splints per day is almost $190,000 before you factor in the cost of the printer. The carbon system is not inexpensive, but even after factoring in the significant annual fee for carbon, you can see if you're just making 10 splints per day, you're making close to $150,000 a year. And if you've got more splint business than that, it becomes printing money. This summary slide is a really nice way to think about it. With every bottle of KeySplint Soft, using the assumptions I just shared with you. So for example, if your profit per part is higher, and it's $100 or $120 per part, you know you're making more money and you can do the math again. But using those assumptions, you can expect somewhere between $6,000 and $9,000 of profit to the lab in every bottle of KeySplint Soft. Let me say that one more time. $6,000 to $9,000 of profit in your pocket with every bottle of KeySplint Soft, where you turn that into printed splints and you sell them into the marketplace. This is an extremely valuable addition to a laboratory's business. It allows you to produce a quality device that is at least as good, if not better, than traditional night guards or splints. It allows you to produce them at volume, and it allows you to do it in a way in which you're receiving a very significant profit on your work. So really, in summary, why KeySplint Soft? From a qualitative standpoint, it's flexible and it's tough. It's not brittle. It's at least as good as other materials when it comes to wear resistance, if not better. It's highly accurate. If you happen to break your splint, or you lose it, or you leave it at your mother's, or whatever it may be, you can easily reproduce it by just calling your lab or having another splint remade for you without having to go through another series of visits and adjustments. The material is very, very profitable for the labs, and even more so probably for the doctors who are doing it directly. The marketplace has spoken. These are some very dedicated users. People who try this material are converted to it. It has changed the way that they are building their practices. We had an orthodontist last week who does a ton of these, who is also a bruxer, who's been wearing this for about 2 weeks and is now completely converting her business over to this material. The marketplace is really, really liking what the quality of this material does. All right. Moving away from KeySplint Soft very quickly, I want to just quickly review some of our other product offerings in the line for KeyPrint. We've got two going with the biocompatible stuff first. We've got a surgical guide material that is very, very strong and very transparent. You can see that it holds up very well compared to our competitors in terms of physical properties. It is validated sterilization protocol. It's been stable and is fully biocompatible. It is a tremendous surgical guide material. We've also last month released Key Tray, which is a really interesting custom tray material. A lot of the custom tray materials out on the market are a little bit stiff and brittle. We have some flexibility with this tray so that it really can withstand the forces of insertion and removal during the impression process. It is a very efficient, strong means of making a custom tray. You don't need models, highly precise and digitally accurate. We're really excited about this material. And then we've got our laboratory resins. We've got two different model materials. One is more of a restoration model for planning. Very great surface finish, very hard, excellent view of the details and the margins and the tooth anatomy. It's easily carvable, and it pairs very well with some of our thermoform materials and our key mask material in terms of planning gingival appearance during an implant or a restoration planning. Our ortho model is very fast and accurate. It's designed for thermoforming like aligners. So for those of you who are making aligners either in your lab or in your office, our ortho model is designed for fast, accurate printing and is very temperature stable. So it will withstand the forces, the heat and the forces of doing thermoforming. We have a castable material that burns out very well. It's compatible with all metals, chrome, cobalt, gold, silver. There's no residual ash. It's very low shrinkage. It will not blow apart the flask. And we also have a customized investment material to go along with this that is very creamy, easy to use. And so KeyVest and KeyCast together are a really nice workflow for those folks still doing metal frames or crowns. And then lastly, at this time, we've got our key mask, which is a nice gum tissue, really helps give a touch of color and lifelike feel of gums when you're planning for your restorations. We are rolling out this year an intro kit of the lab resins. So for those of you who want to try it without going and buying a full bottle, we have 0.5 kilograms of all 4. You can buy it in one full fell swoop and get all 4 resins in a testing size pack out for yourselves. We have put together a polishing protocol for KeySplint Soft. A lot of people asking how to polish it. On our website, you will be able to access both a written polishing protocol and a video that goes step by step to show you how to do it. Every one of these materials used in this process is available from Keystone, and you can see on the screen. We list out the products in the workflow. It takes probably about 5 to 8 minutes to complete a full polishing of the splint, and it's a really nice process. Works quite well. We got a lot of feedback from the field. ProTech in Vancouver was really helpful to us in establishing this protocol, and it's been working quite well. So anybody who has a need to either polish splints or surgical guides, this protocol works really well, and you can check out the details on our website. What's coming next? Well, that's always an interesting topic, and people want to ask a lot about. We are working on a series of materials that'll probably be hitting the market over the next 6 months. We have a hard splint that will be released that really focuses on a retainer application. It is a nice complement to KeySplint Soft. We have our denture base and teeth that are working their way through testing and are expected to commercialize this year. We have a temporary crown and bridge that is on a similar path. We have an indirect bonding tray for orthodontic bracket placement that is probably going to commercialize in the next month or so. The feedback from the field has been tremendous on this product. And we've got several other exciting applications coming. Before I turn it over to Doug, the last thing I want to mention is, for those of you who are looking for more information from Keystone about what we're doing with our 3D printing, how we're partnering, which printers we're working with, which labs are working with us. Just yesterday, we put up a really nice piece that involved Drake Dental Labs in North Carolina and discussing their adoption of KeySplint Soft. We are constantly updating our Facebook user group and our community page. Here is the information here for you. If you want to click on or write it down, just send us a membership request. We'll be happy to admit you. And you can follow along for updates on what Keystone is doing. So I'll be looking forward to the end of the presentation when you may have some questions to float to either Doug or I. And at this point, I'm going to turn it over to Doug for his portion. Doug, can you hear me?
There we go. Sorry about that. Hey folks, thanks for having me on the webinar today. So today's objective really is to kind of go through some of the options that Zahn offers, but is also our partnership with them and what our resins can do in some of the equipment they provide. Just a little bit of background on myself. I've actually been in the dental business for more than 20 years, and the majority of that time has been involved with the CAD/CAM systems that are out there, and that includes softwares, milling, and printing. You're going to have to advance the slides for me. So just a brief introduction as to what the market looks like now and actually into the future. So currently we're looking at about $2.7 billion in revenue that's being created out of 3D printing last year, and that's expected to grow to more than $9 billion, that's a B, by year 2028. So estimated that 60% of the dental production will be in 3D printing. That may be alarming to some, and some may actually question that, but if you look at where we were 7, 8, or even 10 years ago with a PFM type business and how fast that moved to milling, I would expect that you're going to see similar growth in this market. One of the differentiators is early printing really was limited by the materials that were available. And one thing I think that Keystone does really, really well is validate these products and get them and make them useful in a dental laboratory and or practice. So these are materials that we couldn't even really imagine just 3 or 5 years ago. So North America is, as usual, the fastest growing market. It's expected to have about a 42% global market, global growth by the year 2025. So 35 to 45% of the labs have at least one 3D printer. What's actually interesting in the market right now is that many of the labs are not just using one technology anymore. So if we went back 5 or 6 years ago, a lot of people jumped into the market with an Envision Tech early on, which is a terrific printer, as well as a Formlabs. These printers were very cost effective. They offered a variety of different materials or workflows. But now what we're seeing is, a lot of laboratories integrated the carbon because it is such a great machine, but they're also looking at, okay, how do I use some of these other materials without tying up that big model machine? So we're seeing a lot more integration in laboratories that are offering 2 or 3 different printing solutions. As far as the dental offices are concerned, where I came, my last position was running a 3D printer company, and we saw a tremendous increase in offices moving in the 3D printing space. We're seeing more and more of them, especially in an ortho setting, wanting to be able to print those models for those first orthodontic liners. The next slide, Ira. So if we look at the overall printer production growth, if we look back to 2014, the own or lease printers were about 11%, as opposed to they were what was planning to purchase, which it was up to 24%. This statistic goes up to 2018, and what I've seen over from 19 and now into this year, the implementation of 3D printers into a dental laboratory is even much higher than this at this point. What we're seeing is that most laboratories are finally seeing the advantages and the utilization of these printers. It's not just for models anymore. We're printing teeth and dentures and soft tissue and soft splints now. All of these things are high profit or high margin products for a dental laboratory. And also you're able to get actually a better product out to your doctors in a faster way. So, and one of the reasons for that is the introduction to the intraoral scanner. This is a slide, believe it or not, going back 12 or 13 years ago now. I was involved in a project where we were looking at the overall digital workflow market and what it looked like. You can see how complicated it was, and it started obviously with the patient and the data collection. This was a very early stage when iOS was not readily available. There was only 2 or 3 options. They were very expensive. They weren't very accurate. They certainly couldn't go subgingival. And then moving into some of the other stuff as far as the designs were very, very cumbersome. From my own experience back with Procera or the early surgical guide designs, those would take hours, if not days sometimes, to produce those. Now there's softwares out there that can do that in a matter of minutes with a lot of automation that's included. And then it really went into the production or the CAM side of things, and you were very, very limited on the types of machines that you could use, and many of them were not available for in-laboratory services, and certainly not 3D printing. There were some very early adapters that might have been using like a Minecraft type printer that they bought at Staples just kind of as an R&D sort of thing, but they certainly weren't considering bringing a 3D printer into their business model in a dental laboratory, and certainly not into a dental practice. So you can see the number of steps that we had to go through back then. When we're looking at this, and it was certainly not affordable either. That whole package there, you're probably looking at $300,000 or $400,000 to get involved in. So how does it transition into where we are today? What does it look like today? Obviously, we're looking at, we're starting to print dentures now, and we all know this is a process. I think that the denture material out there right now, we're getting to the strength standpoint we need to, but the aesthetics of the product are still somewhat limited, and I think that it's one of our primary targets right now as far as the denture market. It is a huge market, as many of us know, and we're working hard to make this product look more realistic. The surgical guide business, I mean, again, you used to have to send out these things to Noble Biocare back in the day, and they charge you $1,000 for a surgical guide. You can make these guides now in your office for a fraction of that, and some of the other stuff with the soft splint now. So if we take a quick look at the process flow, if you recall that last or the second to last slide I just showed you, how many steps were involved. You can see now it's really 4 steps in the process flow on this has speeded up dramatically. So the iOS printer or intraoral scanner, I'm sorry, is probably the most vital part of this thing. And obviously Henry Schein and Zahn provide a couple of different options on this, the most popular being the Trios. Many of you are already, I would suspect, are already using some type of 3Shape technology out there. But this new iOS scanner that they're offering is doing a much better job than we could have even imagined just a couple of years ago. Many of the labs, use of an intraoral scanner is limited to it going subgingival, and these products now are getting much more inept at doing that, and they're able to go subgingival and actually provide scans that can be used for crown and bridge applications. The ortho or the intraoral scanner market in the ortho side of the business is significantly greater than it is in the crown and bridge space, and we're seeing a dramatic growth in 3D printing because of that. So I'm suspect that we're going to see the same thing in crown and bridge as this technology continues to grow. The next part of this is the software. Software, again, going back through history, was very cumbersome, time consuming, very expensive. Now with 3Shape, and this is another product that Zahn does offer, 3Shape is probably the most universal software that's out there. There is other software suites that are out there that do a lot of the work, but I think that 3Shape does offer one of the most robust complements of design softwares, whether it's orthodontics, whether it's removable, whether it's crown and bridge. The other option, which a lot of your laboratories are using, not for all applications, but some applications are third-party design services, and there's many of them out there. Basically what this provides you is an opportunity to, maybe you're not very proficient at one part of this and you want to outsource it, or maybe you don't have time to do all of the work yourself, or maybe somebody leaves your business or goes on vacation. These services are a great gap filler for those types of situations, and these companies are able to basically design everything that you would want to do in your laboratory at a price, and they send it back to you. And it used to be these services were somewhat restricted by the amount of turnaround time they required. Those turnaround times have diminished dramatically. And the next 2 parts are the CAM part of things, and the milling part is something that you guys have probably been involved with. Most of you probably have mills. There's also milling centers there that are still available to you. This technology is also getting much better, and the options that you have and the materials that you have changed dramatically over the last 3 to 5 years, and will continue to improve. And then lastly, obviously, we have the 3D printers. Here we have the Colzer printer. We have the Envision Tech and the Decima printer there. These are all great printers that Zahn offers, and they're can use a variety of different materials. And going back to what I said a little bit earlier, we're seeing more and more laboratories carry multiple lines of printers, and quite frankly, that's because they're doing different types of work on different types of printers. If you can go to the next slide, Ira. So if we think back from the digital age to the analog age to the digital age where we are now, just a quick reference. I mean, wasn't long ago that very, very few practitioners had this. It was less than 10% integration 5 years ago. Now we're looking at about 22% integration of general dentists and dentists in general that have intraoral scanners in their practice doing crown and bridge applications. If we look on the ortho side, that integration is more than 45%. In fact, it's probably closer to 50%. So we're seeing a lot more adaptation to this intraoral scanning, and we'll continue to see that. So what is the workflow for you in your laboratory? Obviously, you're going to grab those scans, those digital scans from your doctors. They're brought in electronically, obviously, and you're using that to implement those into a design software of your choice. You may choose to use an in-laboratory 3D design service, or you may send it out to a third-party service. And you're going to be designing a number of different things, whether they be bite splints, night guards, and soon to be removable applications. We recommend a minimum, go back 1 second, Ira. Some of these things are important to pay attention to because of the wall thicknesses. If you make these things too thin, they could be too brittle, they compromise the case. So you want to make sure that the side walls are at least 1 millimeter thick. Minimal posterior occlusal wall thickness is 1.5. The recommended wall thickness for night guards is anywhere from 3 to 5 millimeters, and splints is 2 to 2.5. Next, Ira. So another thing that we, in partnership with 3Shape, and this works really well within the Zahn system, is the DME files, which is basically what the software is going to tell the printer to print and how to print it to optimize that material. So the DME parameters are preset in the 3Shape software library and are optimized for all the different KeySplint materials, whether it be the KeySplint soft, or it will be the denture, it will be many of the other materials. And this is actually designed specifically for the different printers that are out there. For instance, the clear splint that we are in collaboration with Carbon and with Zahn with is designed specifically for that printer, and it's optimized for that printer. Now, unfortunately, given the COVID situation, 3Shape is a little bit behind on some of the validations on this and setting these parameters for us. If you need them, by all means, you can reach out to myself or to Ira and to Keystone, and we can help you through that process if you don't have them, if it's not a printer that we have here. So as far as the competitive landscape is concerned here with the 3D printers, if we go back just 5 years ago, there was about 4 or 5 different printers. This is just a fraction of them. Formlabs is a very big market presence in this. It's a product that Zahn does offer. Reason for that, it's a very price-oriented business with that printer. They're very inexpensive. They have some great things about them, and they have some limitations. Some of the other systems that you see here is Colzer. It's another product that it's offered to you by Zahn. 3D systems in the NextDent system. The Stratasys system, a little bit different, is a SLA printer, but still a big printer in the ortho business. Envision Tech, the Envision 1 now has been on the market now for many months and actually has performed very, very well. And we use a lot of their printers and recommend them frequently. Asiga is another one, a true open architecture printer. This one can print any of the materials that are out there. Carbon, which many of you probably are very familiar with, had a huge influence in the business in the last 2 to 3 years. It's a terrific printer. But this just gives you an idea of some of the big players that are in the industry now. So if we look at some of these one by one, the Carbon printer, again, really has made a huge impact in the dental space in the last 3 years, 4 years. This printer, when it came to the market, quite frankly, in my opinion, was looking at this thinking there's no way that price point is going to survive in the dental space. But it really captured the imagination of the dental space and has grown dramatically, and actually has been a huge resource for many labs and brought so much attention to 3D printing. So you can print, when it comes to the splints, about 8 to 10 splints. We actually print them at an angle, at a 40-degree angle, and you can do 8 to 10 splints in about 10 minutes. So going back to the ROI and the stuff that I brought up earlier, you can put a lot of splints through this machine, and it could be very profitable if you're using it to make splints. And there's some laboratories now that are looking at this and using one of their carbons just for splints because the profitability is so high. So what are some of the good things about the Carbon? Obviously, the production level, the high accuracy, outstanding service is something that they're cornerstones, and it's a reliable and repeatable printer, which is really key when you're purchasing a printer. Next. The Envision one, which I mentioned earlier, this is kind of a next generation printer from the old Vita. This thing has taken the business by storm. It's done very, very well. It will print 8 splints at a 35-degree angle in approximately 130 minutes. Again, it's very reliable. It also offers a very robust design feature to it. The resin trays are nice and big. So it's a great printer, and the price point on this one is much more affordable than some of the other ones. It's a good value for the money they're asking. The next is Asiga. Asiga is really one of the true open platforms. They use basically all of our materials at this time. They're all optimized and they're all validated through our system. This one, it's a little bit smaller of a build plate. It'll do 4 splints in about an hour or a minute and 65 minutes. And again, they're printing at an angle. It is a truly open source, so you have a choice of many, many different materials. It is very reliable with close to 4,000 units in the field. And it is also very affordable as far as the price is concerned. It is, again, validated for all the materials that are out there. It's fine. All right, we can go to the next one. The next one is the Sprint Ray, which is the next generation Moon Ray. This is, again, this printer right now is really taking the industry by storm. The price point is very, very aggressive. This is not the same printer as their first gen. This printer has performed very, very well. We have a fellow that works with us, Ben, who does all the validation, and he enjoys using this machine. It has turned out to be very reliable, much, much more than the other one. So it can do 5 splints at a 35-degree angle. It takes about 100 minutes to do it. Again, the price point on this one is low. It is a very fast printer. The build size is a decent size, especially for the money. Very easy user interface. It's all cloud-based, like most of these are, and their support has actually improved dramatically too. So this is a great alternative for a low-cost, high-performance printer. The next part of this is the post-cure, and I just want to mention here, folks. You know, some people look at the post-cure and they say, you know, I can build my own. This is a vital point of the whole process. If we're looking at the process flow, many times people think, oh, it's just about the printing and the material. When it comes to FDA, especially for medical devices, there's 3 parts of that whole process. There's the print material itself, then there's the machine that it's actually being printed on, and one of the more important parts of this will be the autoclaving units. So we highly recommend that you use the proper post-curing unit on this, and this, we can send this out to you. It's on our website as well. It'll show you the different models that we offer and that have been validated with our types of materials. It's very important that you do follow the protocol and the light frequencies that they're using on these post-curing units with the material to make sure that they're fully cured when they're coming or before they're going into the patient's mouth. So there's a couple here, the Dreve, which is offered by Henry Schein, the Auto Flash, which is another common one which we use, quite frankly, that's offered by Envision Tech. And then there's one over in Boston, it's called the Uvitron, that we've had a lot of luck with as well. Next slide. So the next is this validation, and again, we can get you out this slide if you want. Again, this is if you ask me, one of the things that we do best at Keystone is validating products. Most every 3D printer that's out there in the dental space especially is coming to us and asking, can you validate? We do a terrific job at this. We are very, very thorough with this. It's something that I really am proud of working with Keystone on this, because every product, we have meetings on this at least once a week and talking about this and the process that's involved. We have to optimize each one of these printers. We create those settings that are going to be, you know, make sure that when that product comes off those printers that it's cured properly, and then the auto flash as well. So we know when we take that out of the auto flash, this is able and ready to go into any patient's mouth without any concern. It's a very, very valuable point to consider when you're looking at 3D printers, to make sure that they have validation on the materials that you're using, and we're doing our best to work with as many of them as we can. Next, Ira. These are just some of the other partners that are coming. We're seeing more and more 3D printers coming to the market. These are just 4 that we are in validation right now. The Rabbit Shape, which is offered by Straumann, the Origin, which is going to be more of an open style platform. They're out in the Northwest. We have the DEXA, then we have the Shining 3D. So these are 4 printers that we will be having full validation for in the next few months. Next slide.
Great.
I think that's it.
We think we've hit the end. So this is a good point. We've got about somewhere between about 8 minutes left. We'd be happy to take questions that are monitored. I believe that there's a comment section or a way for people to get us a few questions. We'd be happy to do this. And Caitlin, is that it?
Yep, Ira, I'm here, and we did have a couple questions come in, so I'll read those to the both of you so we could address them.
Thank you so much.
Yep, no problem. So the first one here, it's two questions from Kelly. I have an oral sleep device business. Is Keystone soft cleared for sleep devices?
So it depends where you are, Kelly. Generally, the answer is what the FDA's approach to sleep devices is that because they have a separate set of claims that they're actively doing something like opening the air passage or moving the jaw or depressing the tongue or wherever it may be to help with the snoring or the sleep apnea, they're making active claims. And so the design and device that is being produced by the manufacturer ultimately has to go to the FDA and get their own clearance on that device. The material would be a component in that, and starting with the class 2 biocompatible material is a really good place to start. FDA, when we went through the clearance process, said to us, there's other things you're going to have to show to us in conjunction with one of these partners to really get the device cleared, not necessarily the material, but to get the device cleared is adequate. So for US-based sleep and snore companies, we are working with several. We're helping support them with information about the material that then can be worked into their own FDA application to support the safety and adequacy of the device. Canada and Europe are a little bit different, Kelly, so I don't know where you are, but in Canada and Europe, both of those regulatory agencies have cleared KeySplint Soft for use for snoring applications, and we are working with several companies in those territories as well. So it's really a matter of where you are and what the regulatory constraints are around your device. For certain territories, we are absolutely cleared for those applications. For others, we have to work hand in hand with the manufacturers in connection with their applications to FDA.
Great. Thank you, Ira. And then second part to that question is also my components are made from a polycarbonate. Can we bond these to the splints with cold cure acrylic?
The best answer is let's take a look, right? The general answer is the KeySplint Soft is a methacrylate based chemistry. Methacrylates and acrylates generally bond well to other acrylates and methacrylates. In our experience with people trying to make adjustments to the occlusal surfaces of KeySplint Soft have had excellent success in bonding traditional acrylics to KeySplint Soft. I, of course, always ask the question, why wouldn't you just figure that out in the design rather than adding acrylic to it after it's printed and cured? And the answer that I've received from people is, hey, we like to make adjustments. Maybe we grind, maybe we add. And then the answer to that is yes, you generally have a good bond between traditional acrylics and KeySplint Soft. Whether chrome cobalt or other materials actually work well is the type of thing we would be happy to work with you in testing. I don't have an answer as I sit here today with respect to that very specific question.
Got it. Okay, thanks, Ira. Next question here is from Aaron. Can KeyCast be used to print units that would be pressed in lithium disilicate ingots and also pressable ceramics, i.e. pressed to metal and pressed to zirconia?
We have had people who've had good success doing pressing with the castable material in all of those materials. So it's a little bit more anecdotal, Aaron. I know of several labs who've reported back to us they've had good results with that. There have been a couple labs. We have a couple of resources on KeyCast. We'll be happy to, I think they're on our website if you want to check them out. There's a couple articles by Ken Kincaid, who's done a lot of work with doing castable work with KeyCast and KeyVest and has had good experiences with them. And we've had several large labs throughout the United States testing it with pressing as well. So I believe the answer is yes, but we're happy to help work with you to test and see how well it does in lithium disilicate pressing.
Perfect. And then one other question from Aaron as well. On your carbon ROI slide, I noticed at the time of 245 minutes, i.e. design, print, post-process, etc., was the same time when printing 10 splints a day and 40 splints a day. Wouldn't the higher number of splints printed per day increase the print time?
I think you cut out there, Caitlin, but I'm gonna presume the end of the question was if you're printing 40 splints, isn't the post-processing take a little bit longer? I think that's probably true. I think that's probably a good point. The post-processing and post-polishing is not a significant add-on time, but you're right. If you're trying to look at it from truly apple to apple, I think it would be a little bit more than 245 if you were looking at 40. The other part of that, Aaron, is depends on how the lab sets up their workflow. So if they've got someone who all they're doing is finishing and polishing devices, and you've got another set of folks who are doing design and print work, then the workflow, the answer might be it is not terribly different and askew to that. But I would agree with you that there probably is more time that would have to be built in for the polishing and finishing on the 40 splints.
Got it. Next question is from Jared. Hello, regarding the rapid shape printers, I am looking at Key Model, but how do I get the settings to be able to use that in my printer?
So we are working pretty closely with Rapid Shape, as Doug just mentioned. We have very regular validation calls, both internal and with our external partners. With Rapid Shape, we are focused initially on validating the KeySplint soft and the Key Guide material. The next resin in line is Key Model, and I would expect that you would have settings validated and released probably sometime by the end of June. So stay tuned. We will be doing announcements as we roll out validations with Rapid Shape and with some of their partners like Strawman, as Doug mentioned. So I would say it'll probably be about a month before we'll have validated settings with the Key Model. Early results are working quite well. In fact, everything's working really well in that Rapid Shape. It's a nice printer. They have struggled a bit to figure out how to penetrate the United States market. They've had tremendous success in Europe and a really nice track record. And I think that the folks here in the United States who give it a shot are going to be pretty happy with both the ease of use and some of the clever workflow things that they've done in building out their hardware and post-cure. It's some interesting technology.
Great. Well, that concludes the questions for the webinar. Just one quick note that I did see come through. Just to let all attendees know that you will be receiving an email with a link to this webinar on demand. And in that email, we can also include a link to the PDF that shows all of the different compatible printers.
Terrific. I want to thank Zahn for having us. Been a tremendous partner to Keystone over a long period of time, and we'll be looking forward to many more years of working together. I want to thank all of the attendees who spent an hour with us. We went through a lot of material. If anybody has any questions, they have anything they want to know offline, please do not hesitate to reach out to Doug or I. We're easy to find. We're very happy to engage. We love talking to people about their experiences and how we can help them figure out how to adopt 3D printing and other digital technologies into their workflow and maximize the efficiency and the profitability that it brings to your labs. So I want to thank you guys very much. Doug, nice job. You did a really good job on your part, so thank you.
Thanks for having us, folks.
Thank you
We
both.
appreciate it.